Yeah, thanks very much for having me here. It was really nice to get invited by Christine to speak. Before I go any further, I'll just acknowledge the traditional owners of the land, the Wurundjeri people of the Kulin Nation. We've heard, obviously, Aboriginal and Torres Strait Islanders mentioned here. They also, I guess I'll be talking about health literacy, community participation. They face a lot of challenges that are structural challenges based on the fact that they haven't perhaps been treated quite fairly in the past. So yeah, I think it's really important that we acknowledge the barriers that we can create within the health system and more broadly than the health system, towards their health. So I'm talking about organisational capacity building to meet community needs in health literacy, which is a bit of a mouthful of a title, but basically community participation and health literacy are my two areas. I'm currently the Access and Inclusion Project Manager, so I've kind of moved on. I'm still working in the health literacy space, and I'm working in a now different space as well around a project around managing pathways for children with developmental delays. But previously I was the Community Participation and Health Literacy Program Manager. So that was for about 2.5 years. So I'll be talking about some of that. I did bring along, if people haven't seen, I brought along some health literacy and community, the program reports. It's a sort of a four or 5 pager. So if anyone hasn't seen that and is interested, feel free to come grab one after I talk. So today's presentation will cover, so who is Health West Partnership, why were we working on health literacy and community participation, then building a system that supports health literacy, and particularly I'll be talking about the Health Literacy Development Project is a sort of, I guess, the main part of our approach that we did, but also then how we promoted some community participation within organisations and committed to an embedded good practice within Health West ourselves, and also then some other projects that we did empowering communities throughout project work more broadly. So that's a fair bit. So let me know if you have questions. If I haven't explained something as I go, feel free to wave your hand and ask me a question. Otherwise, hopefully there'll be time for questions at the end as well. Just check the time. Okay, so Health West is a primary care partnership. We're based in Melbourne's west, so we cover 5 local government areas in the west. So we're one of the biggest primary care partnerships. We cover, now this is always the way, it's Melton, Brimbank, Maribyrnong, Hobsons Bay and Wyndham. So there's a lot of diversity within that area. Are you guys familiar with PCPs, generally speaking? Some yes, some no. So PCP's West 8 funded by DHHS. There's 28 of us across Victoria. We try to act as change agents, so we're part of the Victorian health system, and we work to actually make changes to the system, but we also need to model good practice and require it of our partners. So Health West itself, we're a voluntary alliance, so no one has to work with us. We have 51 members at the moment, who we all work together to improve health and wellbeing of communities within our catchment. So our members primarily are community health, hospitals, local government. Actually, I should say local government are required to work with us. They're about the only ones that are required to, though. We also have ethno-specific organisations, we have consumer organisations, we have disability, we have a whole range of health and community orgs, so it's quite a varied, and people will work with us on different projects or different priorities based on where their interests are. I was going to say it's nice having Mary in the audience because we have worked with Mary in Health Issues Centre. So we were operating on a 4-year strategic plan from 2013 to 17, so we've just finished it a couple months ago, hence why there's the program report's been doing the rounds. We identified 4 key results areas for that strat plan: health literacy, community participation, integration and collaborative action. Collaborative action, kind of basically it's similar to advocacy, I guess, but obviously we can't advocate for things that in a political way, where we're apolitical organisations. So health literacy, are people fairly familiar with health literacy? Generally? Excellent. So the definition we go off is the ability to find, understand and act on health information, make health decisions and use health services. Obviously there's a number of different definitions out there, but they're all sort of broadly similar to that. Community participation, this is from the DHHS's policy around community participation. It occurs when consumers, carers and community members are meaningfully involved in decision making about health policy and planning, care and treatment and the well-being of themselves and the community. So health literacy was a bit more of an explicit priority for us. It was quite easy to engage with organisations as we went on due to increasing prominence of health literacy. Community participation was a little bit tougher to really help organisations see the direct benefits. We tended to take a less direct approach to our community participation work, and we embedded it throughout our other project work, including our health literacy. And we did a few other things as well to actually explicitly support community participation. Also, I maybe interchangeably use consumer participation as community development. There's a few other terms. We termed it based on who we were working with, so don't get too hung up on the language, I guess. So yeah, actually this is, as Christine said, it's really easy when you're talking about health literacy to think about the individual health literacy. You think about the skills, motivation and knowledge of individuals, and that sort of stuff is like, it's really important. And also to think about certain backgrounds and characteristics of individuals that might affect their health literacy. Do they belong to this group or that group? But it's really important to acknowledge that people don't exist in a vacuum, and the health literacy depends on the demands and expectations that people face. So we talk about this. I should say I haven't actually put up a acknowledgement, but this is from the Australian Commission on Safety and Quality in Healthcare. They have a series of great infographics around health literacy. So we can term this the health literacy environment. It's where, you know, what health information is available, what people are providing healthcare and health services, where are the places, what are they like, where you get healthcare, what policies and processes exist both within the organisations themselves or more broadly at, you know, a state or national level. So these things are really important to actually, to allow somebody to be health literate and access the services they need. And we feel that our role within the health sector, health and community sector, is really to act on the health literacy environment itself. So why health literacy? Almost 60% of Australians have low health literacy. This is from a 2006 stat. Unfortunately, they're no longer doing the measurement that lets us get a good population-wide measurement, so we don't have a more up-to-date stat, but there's no reason to think it's changed too much in that time. Some groups are more at risk of low health literacy: older people, communities that are both culturally or linguistically diverse, Aboriginal and Torres Strait Islanders, newly arrived communities, disadvantaged populations. Being in the west of Melbourne, we have quite a lot of these represented, so chances are health literacy is even a greater proportion of community within our catchment have low health literacy. It's also worth noting really fast population growth in areas of our catchment. Wyndham and Melton both have just really fast population growth. So it's really important that health and community services are able to respond to the changing health literacy needs of their communities, which means it's important that they actually connect with their communities and understand what their needs are. Which brings us to why community participation. So basically it's a right. People have the right to be included in decisions which impact their health. Honestly, it makes sure that the services, information, projects, all that sort of stuff we're providing actually does meet community needs. It's a good way, and, you know, creating some more transparency, that type of thing, and dialogue. There's increasing expectations that organisations, services will use community participation a bit more. And also, because we were looking at health literacy, it really is a key part of improving health literacy, is including community and consumers in what you're doing. So looking more at what we actually did to address these areas now. So sort of three main approaches. We worked to build the capacity of the health and community sector to respond to health literacy needs. And this was really our primary, sort of our centrepiece area. We also worked to build the capacity of professionals and organisations to partner with community and to embed community participation within their practice. And we also then work to empower consumers and communities and create opportunities for them to shape work across the region. To do this, we actually combined health literacy and community participation into one program area. And so when I say we, these decisions were made before I came on board, and they combined them into one program area and then hired a program manager, which is where I came on board. So to get started, we surveyed our members around health literacy. We put it out to our membership. Our membership was about half what it is now, but we only got 7 respondents, which I guess shows that maybe orgs were a lot less invested in health literacy. But even of those 7, none had a health literacy policy or had assessed organisational practice. About a third, just under a third, had health literacy in their strategic plans or within written and web communication policies, and the majority had little or no training to support communication. And again, the majority said that they were just beginning their health literacy journey, which was positive because obviously if they were beginning their journey, then they were clearly planning on being involved. So through this is just some of the things we found. There was a few more spots as well, but basically a lot of orgs were looking for guidance around how do we do this. They'd identified it was an area of need, but how do we actually go about building health literacy responsiveness into their work?
Mindy, sorry for interrupting.
Yes.
It isn't one of the issues that the word health literacy doesn't invite action, and so people don't know how to respond to it. So in one sense, no wonder you only got 7.
Yeah, I mean, it's hard. Health literacy itself is a jargon term. What does it really mean? I mean, people know what literacy means, and that's reading. So I guess, is it about reading information? And there still is this bias to it just being about health information when it's a lot broader. So yeah, it is really hard to engage orgs. We found it much easier to engage hospitals and much more clinical type services than, say, local government, who could really benefit from.
It's only because it's within the standards that they have to, the hospitals. The national standards.
It's gained in prominence a lot. There's a lot of external action going on as well, so that is good. We're actually more and more engaging broader organisations into it.
Use another term other than health literacy?
Look, we'd love to.
Yeah.
So at the moment, because health literacy is so broad, so it's quite high profile at the moment, so we kind of are locked into using it, but we do talk about health literacy responsiveness now is a bit of a change in the language more than just health literacy itself. Because health literacy tends to look at the individuals. Health literacy responsiveness, we feel, does that. We did a community, well, I'll talk about it towards the end. No, that's fine, but it was working with a community hub, so we actually talked about creating a welcoming and user-friendly community hub. And that's the language, because initially we started talking about health literacy and people were like, what are you talking about? And so we changed the language, and so much easier to get buy-in. So we do.
About a consumer friendly?
Yeah.
Okay.
Yeah, all sorts of, so we do tend to change it for our audience as we go. So Health Literacy Development Project was, I guess, where we started out. It was our big thing that we started doing, and this ran through the full 4 years. So it aimed to build the capacity of health and community services to implement health literacy concepts and practices within their organisations, which again is a bit broad. But we started out with, well, actually I should initially say that we didn't do this alone. So we worked really closely with the Centre for Culture, Ethnicity and Health and CoHealth. So it was a really great partnership. We each brought, a training organisation, a partnership organisation, and the actual on-the-ground service delivery organisation could each bring different perspectives and expertise to the partnership. So we started out developing the health literacy development course. which we all worked together, and we also brought in a content expert from the US who is a lot further advanced in health literacy work than what we are in Australia. So we aim to basically create health literacy change champions, both individuals within organisations and organisations themselves. So we actually delivered 4 annual courses. So the course was actually delivered at a time to 20 people from 10 organisations. So there was always, someone always had to have a buddy within their organisation they could work together. It was 4 face-to-face full-day courses, full-day sessions, I should say, spread out over about 6 months. And in between, they were actually required to do projects, supported projects, to actually put into practice what they've been learning. So all up, we delivered to 80 people from across 24 organisations in our region. We also required executives at the start. We asked executives to sign up, basically, and okay. So this was the high level executives had to okay that their organisation was participating. We didn't see it just as these 2 people were participating, it was actually the organisation was participating. But that really wasn't quite enough. So then from 2014 onwards, we added an executive sponsors workshop, which was a half day where the participants and their executives would come in. So it was actually around building the capacity of executives, their knowledge, but also having them involved in some planning. So it again felt like created a bit more of an authorising environment, and the participants had, I guess, just felt a bit more enabled to just go forth and create changes. In 2014, we also implemented a health literacy community of practice. So this grew out of the first course. They participants. So at the evaluation at the end of that first course, found that participants really had actually developed an informal community of practice. They had worked together to actually develop their practice, because it was really a practice-focused course, and they were supporting each other, and they really appreciated that ability. And then they were a bit worried about leaving the course and losing this connection. So we actually created a community of practice in order to support people who've done the course or other people who are working in the area. It was led by a leadership group with, so there were people from each of the 3 organisations, as well as a couple of other leaders within the area, and some community members as well were on the leadership group. So we planned quarterly meetups and sessions that would focus on different things. 2016, we started a Health Literacy Practitioners Alliance. So we actually found, as more and more people were participating in health literacy, there was actually a bit of a divide between individuals who were looking to improve their own health literacy practice and people who are actually working to create change within organisations and had that really core health literacy practitioner role. So we actually developed up this Health Literacy Practitioners Alliance as a way to have peer support for individuals who were in that more really hands-on active role, so we could bring things together and share and hopefully learn together. So this is still kind of evolving. So another really key part was we actually had yearly evaluations conducted by an external evaluator from the University of Melbourne, and that was incredibly valuable. It formed a developmental evaluation process. So each year we'd have an evaluation done and then really pay attention to what it told us and fold that into our planning for the next year, hence why we have things changing and evolving as we went, and even the content of the course would vary slightly and that sort of thing. So yeah, it was really, really interesting actually. You can see that at the start, well, I've mentioned community members were involved in the leadership group, and they're also in the Health Literacy Practitioners Alliance. At the start, I guess we probably didn't do a lot of community participation because I guess we were still learning. Our community participation practice has definitely evolved a lot over the last 4 years. So yeah, that's something that we are still striving to build in to our work, but yeah, at this earlier stage, I think the course probably could have benefited from more community participation. So that's just something but that's okay. You can only do what you can do at the time, and learn from what you've done. So, key achievements so we found that the course and the community of practice actually did create some changes. So it was evaluated using a ripple effects a model. So we were looking at the splash, the direct outputs of the course, as well as then ripple effects, the things that were ongoing. So each year the evaluation, then the ripple effects were getting broader. So it succeeded at creating changes at both individual and organisational level. So you can just see some of them up there. These were the much more specific individual activities that happened as part of the course. So there was, knowledge, skills, information, audits of policies, developments of policies, that sort of thing, and then leading on to increased confidence, leadership, partnership networks, and then organisations actually dedicating resources around prioritising health literacy and embedding it into practice. Now this is a bit of a very full slide, so it's okay, I'll go through it a bit. So at the top you can see, so this was a survey that we did at the start, we then repeated towards the end of 2016. So there was about 3.5 years between the two surveys. So to what extent are health literacy practices applied within your organisation? It's quite interesting to see. So we had a lot more responses, 18 responses in 2016 versus 7 responses. So clearly a lot more organisations are actually engaging around health literacy, which is great. So at the start you can see all organisations were either not started or just beginning their health literacy journey. By 2016 there was still even more organisations had not started or just beginning, but we think these are the organisations who are much more recently engaging around health literacy, because it was, a slow, has kind of been, what do you call it? Anyway, sorry, gone from my mind. But basically it's been a slow rise, and now organisations are much more eager to engage around it. But there's a lot of organisations, half saying they're making good progress or have embedded health literacy principles, which is great. But as far as what does that actually mean, what are the health literacy principles and practices? So look at increase, we've got health literacy is embedded in our strategic plan. Our organisation has a health literacy policy. We've got allocated staffing to health literacy, formally assessing or auditing health literacy practice, community engagement and participation strategies inclusive of people with low health literacy, and staff are encouraged to use health literacy communication strategies with all consumers have all increased. You can actually see there's a couple that have decreased, which because you're looking at such different numbers and they're not really directly comparable, but it is interesting that health literacy is embedded into position descriptions of staff, and producing materials in languages other than English have decreased. So that's something worth noting and considering as we go forward. Just that they might be.
Just on that last one,
yeah.
Because they might use pictorials, diagrams.
Or is it
possibly
that the Centre of Cultural Ethnicity of now
Health Translations Directory?
Yes.
Look, yeah, that is great, isn't it?
Yeah.
Look, I don't know. It could be the different types of organisations that we've engaged with. Like it's the actual, I haven't got it up here, but they have changed quite a lot. So yeah, it could be that they're actually sourcing external information. It could be that maybe they're not. I don't want to, maybe they're focusing on other areas and languages other than English is just kind of decreased a bit. I don't know. We haven't actually really looked into this, and if it's something that we would like to really focus on, we would definitely do a bit more exploratory work around before we.
It could reflect staff changes too, and either the person in 2013 gave one answer because it was politically correct.
That's actually a very good point as well.
Or in 2016, the new person was too new, didn't know about resources, something like that.
Yeah, you're right. This is self-reported, basically one person answering on behalf of an organisation. So that is, and remember the numbers are really low, so you probably can't, so it's not, it's good though, I guess it does show a trend. There's a few more things. These are the only two that showed a drop. There was other indicators that I haven't included on the slide that also rose, so that was.
It might be also the whole, reflection on what this project was going to do, examining health literacy, and very often
no, that's a good point. Which brings back to the pictorial resources and various other things, or actually using interpreters rather than translated. Yeah, yeah. Yeah, and because I think translating materials, it also I think reflects, we have, I mean everywhere does, there's so many different language groups, and if you're going to spend, it's quite an expensive and time consuming process to really effectively translate materials. So possibly it's organisations deciding, you know what, we can actually achieve the same outcome, doing other things, because if you translate it into, you know, your four most common community languages, that's still a lot of community members who are left out there and who often maybe have greater need, because, you know, the more established, the larger groups that would be more likely to have, you know, your Vietnamese and that sort of thing, maybe have a lot more supports, and there's other new emerging community groups who could really do with the added support. So yeah, there's lots of reasons, but we don't know, basically. So the other thing I should say when we're talking about our outcomes is we didn't have time to do as much within this time period. You notice we haven't actually evaluated, this is completely looking at organisations, we haven't really talked about evaluating consumer outcomes, community outcomes. That really wasn't within the time frame of our project, unfortunately. We're still really interested in doing it. We really considered it, we had some money that we could put towards another evaluation and decided it would be better to leave it for another couple of years. We're still working in this space, but ultimately, you know, it's all very well for organisations to have policies and do all the different things and, you know, look at their communication styles and that sort of thing, but if it's not actually improving consumer experiences and outcomes, then what's the point? So it's something that we do, you know, really need to do longer term just to show that it's actually worth doing. So I just wanted to mention that. It is still in the works. Hopefully we're still working in the health literacy space. So ongoing work in health literacy. So that was basically what we did, a very, very summarised version of what we did in 4 years on that project. So out of that, there's a number of areas have grown and are ongoing. So we've recently submitted a paper to the Australian Health Review, and it's, you know, going through multiple review processes. So hopefully it'll be published. I'm not sure, it was meant to be published around mid this year, but that's not going to happen. So anyway, that'll happen at some point. So the CEH is still delivering the health literacy course. We don't really need to co-deliver it, and we've actually stepped back from delivering it specifically within our region anymore. But obviously organisations are still attending. And a number of other PCPs and regions are using a similar approach to us, which is really great as well. It's a good way of generating some interest and momentum. Another thing we've been talking about is the need for a health literacy course for consumers. I know, I was just going to say, luckily this is Health Issues Centre. Health Issues Centre is definitely in the right space for that. Yeah.
So Health Issues Centre recently piloted a unit on health literacy with consumers, so it's specifically designed for consumers, and the feedback was extremely positive. So we're rolling that out. If you're an organisation interested, you can contact us about running that for your consumers, or there'll be dates also posted that people can attend.
Excellent. Which is, really exciting. I should actually say though, in the 2016 course that we ran in our region, we had 2 consumers participate in that because they are consumers who actually doing a lot of work with one of our local councils, and so they really were still doing that trying to create change. So they were definitely able to do that, and it worked really well actually. Initially there was a little bit of, will they fit in, will it work? But it went really well, so that's really great. But it's quite a different consumers who are actively involved as participants versus other regions. So that was really interesting. What else have we got? Drop the Jargon. So this grew out of sort of the alumni of the course. So Centre for Culture, Ethnicity and Health brought us, actually what's the time? Sorry, I'm running a bit over. Brought us all together around, let's do something, a bit more of a broader thing. So we developed up this Drop the Jargon Day, which is people pledging. There's a website where you can go and pledge, and that's slowly, it's been running for a couple of years and it's slowly gaining in popularity. So that'll be happening on the 24th of October. The website should be being updated about now, and then it'll start getting promoted again. So that's happening. The Victorian Primary Care Partnerships are actually developing an online health literacy course. So that's a much smaller training that's more around just knowledge. But that's something that a lot of orgs were saying, they just needed a basic accessible. So that is almost done. There's 5 modules, an introductory module, and then different, elective modules based on what your role is. It's in final testing phase at the moment, and hopefully we'll be launching in September. So that will be free and available online. So I guess watch this space as well.
Can you send a notice to me about that so I can send it out?
Sure. Yep, that I will do. Yes, hopefully they'll be getting a fair bit of promoted, hopefully, but so let me just notice too. Okay, so I guess I wanted to talk about what helped us create organisational change. So what were the things through our various processes, what were the really key parts? So we wanted to identify, so harnessing the internal and external drivers was really important. So there was a number of drivers that came up as we were going, and health literacy being incorporated into accreditation, that sort of thing was all really important, both within an organisation and more external. We worked on building workforce capability, so it's not just about workforce knowledge, it was actually really the capability itself. So it was really practical and experiential learning that we did. So that was pretty important. And the supported projects to actually put into practice what you've learned was a really key thing. We provided a range of learning opportunities, but also we built the capacity of executives and leaders as well as the practitioners. So I guess it was the bottom up and top down kind of and meet in the middle, hopefully, approach. We really focused on creating change agency at individuals and organisations. And we really then focused, so the training included actually change management and what is change and how do you go about creating it. We also focused on some key areas, policy development, action plans, staff training and senior commitment, that were really sort of a smaller number of key areas for change. Sustained partnership and leadership was really important in encouraging that sort of within our organisations, and obviously our planning and evaluation was really key. The developmental approach, we used cycles of evaluation and planning, was really, really important to allow us to, constantly evolve. So this is just some other things that we did. Sorry, I'm running quite over time. Some other things that we did supporting community participation more broadly. We ran a community participation practitioners network that started out as more of just a broad networking thing, but evolved into a bit of a focus on practical skills development. We worked with consumer participants and other organisations to actually share their stories of participating. So it was really promoting community participation to organisations and community members. We did a report on community participation, basically a mapping exercise to actually look at what was going on in our region, where could organisations improve. We identified 4 key areas that organisations really could focus on, around including consumer participation in high-level decision making, sharing expertise within the region, building staff capacity and measuring outcomes, but as well as roles for Health West and broader organisations, government and funders could play to support consumer participation. So these are all available on our website. We also changed how we did business ourselves. So these are just some of the things that we did. So this is within Health West itself, because we lead a lot of partnership work or participate in partnership work. This then had the ability to kind of knock on to a lot of broader projects. So we created a position statement just to put it out there, what we were committing to, and sort of, I guess, what we were expecting from our partners as well. Obviously created a policy and procedures to support consumer participation, included things around planning, evaluation, remuneration payment of our consumer participants, recruitment and orientation, various things. We've also been working to actually get community participation into our governance. So we've changed our governance structure, and we've now got a community advisory group that has direct input into our strategic planning, which is because we always go out to our membership for all sorts of planning, so now we include community members in that as well. We're looking at having community representation on our smaller management board as well, but I'm not sure about that. We'll see how we go. We have a community engagement, a Western Community Network, just where people can sign up to then get opportunities, that sort of thing, to participate. Obviously, we've got resources around actually supporting our community participants and supporting our staff to actually correctly support their own community participants, so it's not just one person doing the job. We were looking at, obviously with community participation being an expectation for staff, we've actually been changing how we recruit as well. So we've got community participation in staff role descriptions, that sort of thing, but also looking at different ways of how we can actually use community participants within recruitment processes, whether that's sitting on recruitment panels. I was actually hired with a community member was on my panel, which was really, really great actually. But also there's other ways as well that we've got a case study of a different way that we've looked into it. Also around just a checklist for written information. It's basically changing how we're, just trying to hold staff accountable for how they're communicating more broadly, to make sure that our communications, we don't have separate communications. Well, this is the high level communication and this is for the community members. We're trying to communicate in ways that are much more accessible all the time. So what we also are doing is, so now finally I'll just very quickly touch on some of our projects, because this is the other really important thing, is we do a lot of other project work, and it's really essential that we build health literacy and community participation into our work that we're doing, to really also, empower communities to actually act on their own behalf, because that's of course the other really key part. So we did a Better Health in Braybrook project. So this was actually the hub project I was talking about, where we were creating a welcoming and user-friendly hub for the community, and we worked with Maribyrnong Council, Co-Health and community members. We did a Preventing Gambling Harm project, which was again a capacity building project among some key ethno-specific organisations that are our members. So it was actually developed up a training manual, which would then enable, it's designed to raise awareness and reduce the frequency of gambling in culturally and linguistically diverse communities in Victoria, as well as there's some multilingual posters to be used. But that really is about supporting these ethnic community organisations to actually go out and raise awareness and do training within their own communities. We did a Diabetes Out West. Again, this was based in Braybrook initially, looking at diabetes is a really high need, and some other chronic diseases are a really high need within Braybrook, and more broadly as well in the West. But we actually looked, and there's actually quite a lot of services available, but it was people were having trouble accessing and finding the services and understanding what different services to use. So we've actually created a website that enables people, because most of the services you don't need a medical referral for, you can just self-refer. So we created a website for people that just explain what are the different health professionals that provide diabetes services, how much do they cost, what are the questions you should be asking when you go, where are they, so you can use an interactive map to find them. So that's actually doing really well at the moment. And we're slowly expanding it out to include, started out just as Braybrook, but it is expanding out into broader and broader areas within the West, which is really great as well. And that's getting quite a bit of traffic, which we're really happy about. And I should say, this was developed up with a reference group of Braybrook community members. All of these projects have had community participation throughout the whole process. Our 3021 was based in the postcode 3021 around St Albans and a couple of other suburbs. It's really a place-based community development project. And sorry, I just got Yeah, that was really, we again supported community members to actually run their own health-based projects within their own communities, and then just provided tailored support based on what they were doing and what they needed. There's a range of case studies have come out of that. There's also from this, we've actually done a place-based report looking at varied different approaches to doing place-based work, because it's quite popular at the moment. So comparing 3 different place-based projects that took really different approaches to actually talk about pros and cons of each approach. We've also then we're doing work around actually supporting, there's a lot of projects like this that kind of train up and support community leaders, but then once they finish the project, where do they go, what do they do? So we're actually doing work around more of a community leader-led support network for community leaders. So it's a really interesting one, but that's definitely ongoing. So now to summarise, I just whipped through a few other projects, and we're doing other ones as well, but we're pretty much now have community participation and health literacy within a lot of our projects. So it was really interesting because, talking about this really broad approach, what was the summary? So basically, we took a systems approach to building the capacity of organisations and the workforce, and it proved quite successful. So yeah, these were the 5 things that were really key to consider. Your drivers, focusing on workforce capability rather than just knowledge. Just really think about how to effectively create the change you want to see. Partnership and leadership, and then using cycles of planning and evaluation. And finally, community participation is becoming a normal way of doing business at Health West, and which has influenced broader organisations and communities throughout our projects and our partnership work. So that's it for me. So thank you very much. This is my email address and our website. So we have a newsletter. You can sign up to the newsletter if you're interested, a monthly newsletter on our website. And a lot of information and access to all reports and things based on what I've talked about. Or you can email me if you want more info.